infection prevention and control risks in the healthcare built environment for building services. This toolbox talk will outline best practices to be implemented to enhance infection prevention and control IPC safety during the construction or refurbishment of a healthcare facility. The importance of IPC in healthcare construction and refurbishment projects cannot be underestimated, and construction teams have an important role to play in this, as infrastructure is a key pillar supporting the principal aim of promoting improved safety, standards of care, and well-being for patients. IPC risks should be identified and evaluated in the planning stages of any project, and these should be mitigated through the application of infection control measures before the work proceeds. Practice and behaviours are important for everyone involved at all stages of a construction or refurbishment project to reduce the risk of infection to patients who will occupy the area and utilise the services within it. The learning objectives are to describe the IPC risks associated with construction and refurbishment of healthcare facilities, understanding how and why these risks occur. Identify what actions can be taken to mitigate these IPC risks. And apply knowledge regarding best practices that will enhance the safety of healthcare service users, staff, and the wider public accessing healthcare facilities. It's important to reduce patient, staff and visitor exposure to hazards when working in a live healthcare environment. Scottish Health Facilities Note 30, SHFN 30, provides a series of best practice guidance documents, including the HAI Scribe process. HAI Scribe aims to manage infection risks using a prevention and control of infection questionnaire. These guidance documents provide built environment infection prevention and control information for healthcare project teams, which help identify, manage and record risks. The project team and contributors from the various disciplines involved will take different advice from the guidance throughout the varying stages of a project. The Health and Safety at Work Act 1974 places a duty upon organisations to ensure, so far as is reasonably practicable, the health, safety and welfare of those affected by their work activities. This includes staff, visitors and patients. This duty also encompasses compliance with legal obligations under the Construction, Design and Management Regulations 2015, CDM 2015. In NHS Scotland, a health board's control of contractors and site management policy aims to provide information and guidance which ensures safe and effective working practices that comply with statutory requirements and contracted obligations. Evidence which demonstrates that contractors and operatives have the skills, knowledge, training and experience to carry out the work safely should be requested by the health board. A project-specific construction phase plan is required before any construction work begins. Working together and noting key points will assist in the planning and organisation of a project, ensuring that the work is carried out without risks to health and safety. It will also help to comply with CDM 2015. The Health and Safety Executive HSE outlines the legal duties and responsibilities on employers and employees in relation to PPE at work. Operatives' workwear should be applied and removed on site at the beginning and end of each shift. All items of PPE should be compatible when worn together to ensure adequate protection, kept well maintained and replaced immediately if they become damaged or contaminated with hazardous chemicals. Dust should be cleaned off reusable workwear using a HEPA vacuum cleaner before leaving the worksite. It's important to consider that you may be working within a live healthcare environment that is already in use, caring for vulnerable patients. Building and service user adjacencies and any associated risks should be considered and addressed by the project team before any work begins. Some of the key hazards and associated risks to consider when working in a healthcare environment are air quality, dust from demolition, construction and refurbishment activities which can lead to respiratory irritation or infection. Water quality, inadequate management of pollution hazards during construction, risks contamination of water drainage channels and nearby water courses. If these feed into sources used by a live healthcare environment, vulnerable patients could be at greater risk of waterborne infections. Noise pollution, which can cause disruption to patient rest and increase stress and anxiety. Disruption, changes to routine patient care activity and access. Physical safety, risks in a worksite, debris, surfaces and materials that could cause injury if left accessible. Measures that may be implemented to mitigate some of the hazards associated with construction or refurbishment work might include building precautions. Check asbestos survey records before work begins. A pre-construction asbestos survey may be required. The building should be thoroughly cleaned after any furniture and/or equipment removal. Airborne decontamination methods should be considered before any demolition. Control dust and airborne contamination. Dust spread risk should be assessed during the planning stage of a project. The prevailing wind direction should be considered and proximity to occupied spaces. Dust suppression, for example water misting, during dry weather should be considered and implemented where appropriate. Other dust control methods should be used at different stages of a project. This may include the use of portable HEPA-filtered air scrubbers or extractors to capture airborne particles during work, as well as negative air pressure within work zones to prevent dust movement into adjacent areas. Fungi such as Aspergillus are naturally present in the environment. Their numbers can increase where large amounts of dust are generated, creating a hazard for vulnerable patients within a live healthcare environment. Under certain circumstances, this could become an infection risk and potentially result in a life-threatening illness. Protect adjacent areas. Seal doors and windows near the work zone and notify staff in advance. Carry out extra cleaning in nearby areas prone to dust ingress. Schedules for checking, cleaning and replacing ventilation filters may need to be increased during construction or refurbishment activities. If dust loads are high, ventilation filters should be checked before, during and after works and replaced where required. Minimise noise disruption. Schedule noisy work at set times and inform healthcare teams beforehand. Plan safe access and egress. Use routes that cause the least disruption in live healthcare environments. Keep emergency access clear at all times. Segregate workflows. Separate work areas from any patient, staff and public areas to protect people, equipment and the environment. Waste removal and containment. Remove waste in sealed containers. Use temporary containment barriers and tack mats at entry and exit points when appropriate. Hazardous materials. Dispose of dangerous substances according to relevant legislation and guidance. Monitoring implemented control measures will be required throughout construction or refurbishment. During construction, it's not just dust and debris that we need to control. Food waste can attract pests such as vermin and rodents. Animals can carry and spread diseases which could contaminate construction materials and the healthcare environment if they are able to encounter it. Contamination of healthcare environments and materials within them can be a serious hazard and present an infection risk for vulnerable patients who may later come into contact with them. Do not take food into work areas. All food should be consumed in designated welfare areas. Where drinks are consumed on site, containers must be discarded of appropriately. Where external work is being carried out, building and structural openings should be secured and sealed to prevent animal and pest entry. Once services, for example ventilation, plumbing, cabling, are installed, ensure openings are covered before carrying out further work. This prevents dust, dirt, moisture and other contaminants from entering. Appropriate covers or seals should be used that are secure and durable for the work duration. During refurbishment or maintenance works, water and ventilation systems should be protected or temporarily isolated. This reduces the risk of environmental contaminants being introduced or spread through the system. Contamination of ventilation or water systems can require expensive cleaning, flushing, or replacement, delaying the project. No waste or fluid of any type should be disposed of into internal sinks or sanitary ware during construction or refurbishment works. Designated welfare facilities should be provided and used for hygienic purposes. Water ingress and leaks, for example, a leaking roof or windows, are a hazard during construction, refurbishment or maintenance works. Where it may be typical for these to occur on non-healthcare sites, in healthcare facilities they should be avoided at source wherever practicable, as they may provide hidden opportunities for germs such as moulds to grow. Mould may start growing and spreading in as little as 48 to 72 hours of water damage occurring. Advice should be sought from the local IPC team to ensure any clinical risks have been fully considered and included in the rectification process. If issues such as this aren't recognised and addressed early, vulnerable patients could become seriously unwell as a result. In healthcare settings, any harmful germ that grows in the environment, water or ventilation systems can be a serious risk to the building and the people inside. All staff on site, including the contractors, should report observed leaks or water ingress inside the building from any source, and a system should be in place to record this and ensure rectification is managed. Issues should be investigated urgently and rectified immediately, and any remaining water should be removed to help prevent the growth and spread of harmful germs within the environment. Adherence with best practice guidance, along with continued vigilance from all those involved in healthcare construction, refurbishment or maintenance, is essential to minimising hazards and providing a safe healthcare environment for patients, staff and visitors. Infection prevention and control is everyone's business. Thank you for participating in this training session. If you would like to provide feedback or get more information, you can contact us via our email nss.rhica@nhs.scot. We want to thank our colleagues from across NHS Scotland for their invaluable input and feedback into the development of this training. NHS Education for Scotland, NES, and the Clinical Assurance Oversight and Advisory Group members.
This animation was designed by NHS National Services Scotland's Creative Services team. If you have any questions about the copyright or using imagery in this video, please contact nss.creativeservices@nhs.scots.